Alright, let's talk about cesarean on maternal request. So about 2% of deliveries are cesarean by maternal request. Benefit and risk of C-section on maternal request versus planned vaginal delivery. So maternal outcome, obviously with C-section we have increased cardiac arrest, wound, hematoma, hysterectomy, anesthetic complications, VTE, longer hospital stay. However, the absolute risk of severe morbidity is very low, 2 out of 1,000. We have to counsel the patient about the risk of accreta and hysterectomy with repeated C-section. And then also neonatal outcomes. If we're doing a C-section, it should not be before 39 weeks due to if delivery before 39 weeks, we have increased risk for transient tachypnea of newborn, RDS, persistent pulmonary hypertension, hypothermia, hypoglycemia, increased NICU stay. Let's also talk quickly about abnormal implantation due to repeat C-sections. So risk factors for abnormal implantation. So if you had a the placenta accreta risk after a placenta, if you have placenta previa, is with first C-section 3%, second is 11%. Third is 40%, fourth is 61%, fifth is 67%. If you have no previa, the chance of accreta with the first C-section is 0.03%, second C-section 0.2, third C-section about the same, 0.2 or 0.1, fourth and fifth 0.8, 6 and 7 is 4.7, 4.7, not 4.7. So basically 5%. Let's just do 5%. Presentation of accreta will get antenatal bleeding, unable to separate placenta at delivery, sequelae, increased risk in preterm birth, intraoperative transfusion, infection, perinatal death, maternal death, ureteral ligation or fistula formation, spontaneous uterine rupture. On the image, ultrasounds, we see venous lakes or placental lagunae. Retroplacental myometrial thinning, loss of normal continuous white line representing the bladder wall and uterine serosa interface. MRI can help us identify more clearly. Labs usually will have elevated maternal serum alpha fetoprotein, MSAFP. Management. Prenatally, steroids is given between 23 to 34 weeks if delivery is imminent. Anti-D immunoglobulin if Rh negative. Avoid pelvic exam. Consider bed rest after third trimester, especially if bleeding. NST is not indicated solely for accreta. Serial sono is not indicated unless to assess bladder involvement. Delivery, if accreta, 36 weeks. If just previa, 36 weeks.